talk a little bit about kind of what are some of the differences that you see in terms of, the approaches that work for really making resources and care more accessible to that population? What are the things that we have to do differently? What are the things that we get wrong about that population?
Wow, where to start? I mean, young people, they have a much higher bar for user experience. So, much more thoughtfulness around how we're designing products specifically for them. It either has to match the experience of a lot of the big tech social media companies that have invested millions and millions of dollars in their UI, or they actually have to be embedded, or we have to think of how we're actually leveraging those social media platforms to reach and engage adolescents, which is a tricky thing because depending on the situation, social media is oftentimes part of the problem with mental health issues. I can't even imagine, thinking back as an adolescent, it was like, oh, who is on AOL Instant Messenger? And all of those three girls just logged off at the same time and no one replied to me. And now with Instagram, it's just like magnified all of the different directions it could go. But to leave it more on a positive note, there's also so much more advocacy happening on these platforms. Youth are finding their voices, finding their ability to share their stories in a much more scalable, interesting, and engaging way than certainly I did on my forum with anxiety in teens. So that's one positive aspect. I will also say it can be difficult to develop tools and online resources for this population, just given different consents that are required, COPA laws and whatnot for what you can do for 13 and under year old. When do parents need to sign off to be able to connect young people to services? So there's more aspects to think about.